The two most common forms of dental problems are dental caries, commonly called cavities, and periodontal disease, commonly called pyorrhea. Dental caries attacks the hard tissue of the teeth, that is the enamel and dentin. These cavities are decalcifications of the enamel and dentin of the tooth, resulting in a crater-like hole on the surface. These types of problems are very prevalent among younger developing teeth, but can also affect the adult. Periodontal disease affects the gingival or gum tissue, which normally surrounds and supports the tooth in its bony socket. This type of problem usually occurs in adults and can result in loss of a tooth because of the destruction of the membrane connections between the tooth and bone. The gums are sensitive, usually appear red and swollen, and may bleed upon touch. If we look at the parts of a tooth, we see that it is a much more complicated organ than might be supposed. On the left of screen, we can see that there are three major divisions of tooth structure: the crown, which is visible above the gingiva, the neck or constricted area, which attaches to the gingiva, and the root, which is normally below the surface of the gum held in the bony socket. The tooth is made up of three kinds of calcified or hard material: the enamel of the crown, which is the hardest substance in the body, the dentin, just below, consisting of a rather porous layer, and the cementum, which is softer material and makes up the entire root. Within the dentin and cementum is the living pulp, which consists of blood vessels and nerves. Directly below the sulcus, the fibers of the periodontal ligament act as shock absorbers to cradle the tooth in its bony nest. Dental caries can be described according to how deep it has progressed and what dental layers have been affected. The diagram shows three stages of progression, first involving the enamel on the surface. Then, as the decay process progresses, the caries enter the dentin, and if left untreated, the disease process reaches the living tissue of the pulp and destroys it. A closer look at enamel caries shows a discoloration of the normally white surface, with the decay process streaming down from the surface in a somewhat random fashion, often following the surface anatomy of the tooth. In a later stage, the dentin is attacked, and we can see a discrete arrow-like or wedge-like pattern at the end of the dotted line. The decay has an active leading edge, burrowing deep into the softer dentin. The discoloration can be seen streaming toward the pulp, where the dentin's tubule-like structures end. The large vertical dark area in the middle of the tooth is the living pulp. In the final stage of decay, the pulp has been invaded and destroyed. This may result in swelling and/or pain because the living tissue has now been involved. The only treatment to resolve the process of infection is to perform a root canal or to extract the tooth if it cannot be treated. We must think of the ABCs of dental disease. In order to get dental caries or cavities, we must have the three factors occur together: A, an area of susceptibility; B, bacteria; and C, carbohydrates, especially sugar. An example of the area's susceptibility on a tooth can be any one of its 5 surfaces. Bacteria are present everywhere, and since the mouth is the gateway to the body, it is not so surprising to find bacteria normally living in the mouth, hiding in the areas of the tooth where the decay process begins. C, our carbohydrates, especially sugars, form the main food component for the bacteria. They feed, secrete acid waste products, and other materials, which starts the demineralization process. Now let us see how we can eliminate each one of the ABCs of dental disease by proper dental procedures, eliminating the necessity for dental fillings. First, the areas of susceptibility can be made more resistant by fluoride treatment. Now, there are many types of fluoride applications, but the basic factor that makes them work is a combining of the fluoride with the crystalline structure of the enamel called hydroxyapatite. The B factor, bacteria of the mouth, are very diverse, but a few major types are associated with the occurrence of cavities. The elimination of these could result in the stopping of the process that leads to dental caries. The best way to remove bacteria is daily flossing and brushing. Organized bacteria form plaque, and plaque leads to dental decay and gingival disease. An experiment was done in which a plastic mylar strip was fastened around the tooth and left in the mouth without being brushed or cleaned of any kind. After a period of time, the mylar strip was taken off and examined under a microscope. The surface of the mylar strip, now substituting for the surface of the tooth, had picked up large deposits of debris and bacteria. This substance, called plaque, is necessary to begin the dental decay. The effects of plaque can be shown diagrammatically and by the use of microscopic photographs, which tell the story of the beginnings and progression of dental disease. We will first study the effects of plaque on hard tissue, enamel and dentin. As the diagram shows, the plaque builds up on the tooth structure, causing a breakdown of the surface. This hole gets deeper and fills with even more plaque, causing further decay. Dental caries, called cavities, can be clearly shown in the microscopic picture, where the black area of plaque on the surface is accompanied by dental caries, or decay in the tooth structure. Unless the plaque is removed, the decay process will progress further. The effects of plaque on the soft tissue of the gums can be a much more subtle process. It may take years before anything is noticed, but once the tissue is destroyed, the consequences can be disastrous, often leading to tooth loss. The diagram shows that the plaque collects in and around the sulcus near the neck of the tooth. The acid waste from the bacteria generate a destruction of the gingiva or gums. The surface cells are destroyed, and this leaves the nerves and blood vessels exposed near the surface. Then bleeding and pain can follow, accompanied by swelling at the infected site. Periodontal disease can be traced from early healthy gingiva to gingivitis, a mild reversible disease, to full-blown periodontitis. The healthy gingiva appears as a pink and rather tight tissue around the neck of the tooth. The roots are firmly embedded in their bony sockets by means of the fibers of the periodontal ligament. There is no evidence of pain or dysfunction. Gingivitis is a mild form of gum disease which shows a reddened border of tissue around the neck of the tooth. The gums may be sensitive, but the tooth is usually not loose. This condition is reversible with the use of dental floss, brushing, and dental cleaning. However, this condition often goes unnoticed. Early periodontitis shows some reddened areas around the gingiva, but more important are the sections of root which are beginning to show above the gum, especially on the upper left screen and lower right screen areas. These are now unsupported in bone and are the first stages in the weakening of bony support leading to loose teeth. Late periodontitis shows a tooth nearly completely out of the bone. The root can be seen exposed near the center part of the screen. This tooth has little or no bony support from the periodontal ligament and is now loose. It will have to be extracted. The earliest report of bacteria on the teeth comes from Anton von Leeuwenhoek in 1683, when he wrote, "My teeth are usually very clean. Nevertheless, when I view them in a magnifying glass, I find growing between them a little white matter. I therefore took some and mixed it with pure rainwater. Then, to my great surprise, perceived very many small living animals." Modern-day science has shown that proper care of the teeth can reduce dental disease dramatically. Daily flossing and brushing around the gums can lead to a lifetime of good dental health. An example of modern research in the field of dentistry is the knowledge that in some cases decalcified teeth can remineralize if given proper treatment consisting of proper oral hygiene, flossing, and brushing, as well as fluoride treatment of affected areas. While still experimental, some X-ray evidence suggests that an area of decalcification, like the one shown on the right of the tooth in black, can remineralize so that most of the black is gone. All this might be accomplished without the use of the dental drill, but it would take a more modern attitude on the part of the patient.